Hello. Welcome to Mental Health Services and Resources. My name is Kathy Maycumber. I am part of the team from Michigan State University presenting this series of videos that cover various aspects of what is generally called telehealth. This is part 6, titled Mental Health Services and Resources. In this video, we are going to describe different types of services and resources that are all considered part of mental health treatment in telehealth. In this presentation, I will cover a number of aspects of mental health treatment in telehealth. I will describe what mental health is overall. This applies to any treatment setting. I will talk about how telehealth can address mental health concerns and what types of treatment you can access through telehealth. I will describe treatment providers and end with some national and state resources related to mental health. I will also show you a brief video which illustrates a typical mental health interaction following an emergency room visit. The definition of mental health from the Centers for Disease Control and Prevention includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life. Telehealth is a safe and convenient option for getting mental health care at home. You may be able to attend appointments without needing transportation, taking time off work, or arranging care for someone you are responsible for, perhaps a child or spouse. Those factors can be important in a long-term treatment plan. You can participate in one-on-one therapy, group therapy, text therapy, medication prescribing, referrals, and more. In the next slides, I am going to describe the specifics of each type of support available. First, individual one-on-one telehealth is the most common form of telehealth for mental health help and may be able to be performed through video or audio-only telehealth services. It can offer privacy and convenience, including reduced travel and disruption to daily activities like work, travel, and care for others, in addition to easing the stigma of going in person to a clinic or office. You can access individual telehealth in multiple ways. Virtual talk therapy helps address both your emotional, the way you manage and express your feelings, and psychological concerns, like how you process information, think, and manage difficult situations. Telepsychiatry is where you can get prescriptions and manage your medications. Online apps can help you with tracking and monitoring your mood. Text therapy allows you to communicate with a healthcare professional at any time. Group telehealth involves a few people who meet with one or more therapists remotely. This effective and affordable alternative to individual therapy offers the added benefits of community support, reduced feelings of isolation, and new perspectives. There are several options for group telehealth. Live talk therapy is where you can virtually interact with several other individuals at the same time via video or phone calls. Asynchronous communication is when individuals choose to interact by group chat or email. You can share your thoughts and respond to other group members at your convenience rather than in real time like a phone call or in-person meeting. Think of this like email. Online applications involve the creation of a group of people who interact through social media or chat rooms in real time or asynchronously. Sessions typically do not involve a clinical provider and are not covered by insurance, but it may be helpful if you prefer anonymity. Mental health self-assessment is another option for better understanding of your own mental health and wellness. Some examples of online tools you might use include screening tools for things like anxiety or depression. You might see these tools advertised on social media or through an email message. These tools can be helpful in understanding symptoms you might be experiencing and identifying concerns you might have. They can also have negative effects. If you do decide to use an online tool and are troubled with the results, reach out to your healthcare provider to share your concern. Never pay for an online health assessment. There are many good ones that are totally free. Be skeptical of results. Some measurement tools or apps may be trying to sell you something, and/or the results may not be reliable. The website shown includes links to a number of reliable self-assessments. Self-help is when you use your own efforts and resources to cope with challenges and to achieve mental health. Self-help and coping strategies include relaxation training, exercise, proper nutrition, and sleep. Other self-help resources that address issues of mental health and wellness include online applications or other tools like YouTube on your TV, an exercise channel you watch, or community events you attend. These self-help resources can improve both physical and mental health. None of these activities should be thought of as substitutes for other treatments necessarily, and you should talk with your healthcare provider about any and all of them. The National Institutes of Health provide many self-help resources. The website shown here is a good source. Telehealth can be used specifically for mental health care. This video shows a brief telehealth session and illustrates the kinds of engagement you can expect when you have an individual therapy appointment. This is a description of a follow-up from a hospital visit. This would be a possible course of treatment for someone who came into the hospital for a mental health concern. The hospital would have explained the role of telehealth, and the patient would have been given all of the information they need to connect with the therapist.
Good morning.
Good morning, Sean. My name is Marcos. I was asked to follow up with you about your recent hospital visit last night. Hopefully, if you have some time, can we talk for a few minutes?
Sure, I knew that somebody was going to contact me, and so I've been waiting around to join this session here. So, sure.
How are you doing this morning, Sean?
Oh, I'm cranky. My back hurts. I thought they were going to give me some pain meds. I didn't get anything, so I feel like I'm aching all over, and my back is kind of bad.
A little more about me. I work here at the hospital, and our departments are working together to follow up with people who had experiences like you had yesterday at the ER. So I'm part of the team, and my goal is to see if we can actually help you in any way so this doesn't happen again.
Okay.
Yeah. Can you tell me what happened?
Privacy and confidentiality are major concerns in any online healthcare environment. These issues are ones that are the responsibility of both the healthcare provider and the patient. The healthcare provider will often provide a link to a secure website that the patient can click on or enter. Online platforms like Doxy and others are specifically designed for healthcare treatment with layers of privacy settings that limit the risk of exposure of healthcare information. Privacy and confidentiality are also the responsibility of the patient. Making sure you are in a private space with few distractions is important. Engaging in telehealth appointments in a public area or with other people around puts your privacy at risk and should be avoided. Think about privacy and confidentiality online similarly to how you do in an exam room at a doctor's office. Sometimes you can hear other patients through the walls, and sometimes you catch glimpses of other patients' information. These are often not intentional, and they are things the doctor and their staff try to limit. Similarly, the doctor and their staff work hard and have to follow a lot of rules to keep you and your information safe online. Medications for mental health treatment can be prescribed through telehealth. During the pandemic, many of the restrictions previously in place to limit the prescription of medications through telehealth were were changed. Many of those changes have remained in place, including those for medications such as antidepressants and anti-anxiety medication. There are a number of healthcare professionals who use telehealth to treat their patients. Providers you might work with include peer support, where you get help from someone similar to you who has experienced a mental health disorder and treatment. A therapist, a clinical social worker, psychologist, or counselor who has specific training in treating mental health and is licensed. This person can diagnose mental health disorders and can bill insurance. A nurse practitioner, who is a nurse with advanced training who works with a physician to practice primary care. You would look for one with specific training in mental health. This person can prescribe medication if needed. A psychiatrist. This is a medical doctor with advanced training in psychiatry. This specialist typically addresses severe mental illness and can diagnose, prescribe, and treat, but they do not typically do therapy. A physician. This is a medical doctor, perhaps a primary care doctor, a family doctor, or a specialist in mental illness you are referred to. They can diagnose, prescribe, and treat. They do not do therapy. There are many resources available to help with mental health concerns. The Substance Abuse and Mental Health Services Administration Helpline is a national resource. The 988 number is more than just a number to call if you are feeling suicidal. It is also for individuals who need help and resources for themselves or others. The Michigan Stay Well program is a mental health program provided through the state of Michigan with free services and resources. Sometimes mental health issues can be linked to abuse of some kind. This number can link you with resources related to physical and mental abuse, as well as for those experiencing financial abuse. It is pretty common for financial abuse, a relative or friend taking advantage of your generosity or feelings to get money from you, to occur with older adults. Understanding that you are at risk may help you determine if you want more information or help, and this number can be called just for that purpose. To sum up our key takeaways, telehealth can be a good way to access mental health services. Telehealth has many benefits, including convenience and privacy. You can access many different services through telehealth, including a variety of mental health providers and medication. Okay, are you ready for the learning check? To help you see some of what you have already learned? You don't have to turn in your answer. Just think about it, and then we'll look at the next slide for the correct answers. These are true-false questions. Here we go. True or false? Telehealth can be as private as an in-person visit. Second question. True or false? Prescriptions are never provided for mental health through telehealth. The correct answer for the first question is true. Telehealth can be held in the privacy of your own space. Remember, both you and your doctor have some responsibilities to make sure your visit is private, just like in a doctor's office. The answer to the second question is false. Your provider may prescribe medications following a telehealth visit, and this is both common and legal. Thank you for watching. Please be sure to comment to help us improve these videos.